and today we're going to be going back into and having a look at things that are put into the wrong places. First one is going to make you cringe. So just here you can see there is some sort of blade, a knife type of appearance put into someone's down below. For what reason they have done this, I cannot tell you, but one can only assume it must be for some sort of pleasure or some sort of mental health trouble, unfortunately. This is going to be painful. It can cause bleeding, infection, and to get this out because of the shape and the sharpness of it is going to cause trauma, meaning the only way they're going to get this out is by cutting into the crown jewels. Here in this second one, there are 2 bolts being put into the crown jewels. Again, for what reason, only God will know the answer to this. This must have been so painful to have got done in the first place. Removal of this is going to cause so much pain and damage with troubles such as inability to pass urine, painful passing urine, recurrent urine tract infections. This is why they say stay in school. This third picture, we can see that there's some sort of wires or chain link that has been put inside of the genitals. Again, just to get that in there, can you imagine the amount of discomfort and pain that there's going to be to do that? Removing this will actually be easier than the other objects. You're not going to be wanting to wear this around your neck or your wrist once it's taken out. So if you accept jewelry like this from anybody, make sure you say no. What do you make of this object being put here, coming all the way through, coming into the bladder? It's not a snake, it's not a worm, and it's not an alien. In actual fact, it's electrical wires that have been put all the way through to gain some sort of satisfaction. Extracting this will be extremely difficult because of the way the wires get tangled up, the way that they stiffen up together, and so extracting this will cause definitely severe damage and trauma. If anybody has lost any screws and you're missing 9 screws, well, here they are. This person put 9 screws inside of them. You can count them and see for yourself. Some of them are lying side by side together. The last thing you want to be doing to extract these screws is to put your drill into the reverse mode. Just have a look at this massive object placed inside of this person. This was introduced through the rectum, and as you can see, it is absolutely massive. This is extending all the way from the tailbone, known as the coccyx, coming to the umbilicus, known as the belly button. That is huge. What do you think it could be? This is how this object was extracted. A scope was put in through the anus, and then compression was applied over the belly button to push the object out. And here you can see from the different images how this was done. Luckily, this object was completely removed with no damage. This patient was very lucky. This is the size of that object, and as you can see from the ruler there, it is almost 20 centimeters in size. Absolutely humongous. It is safe to say this object was self-made. It was made to give pleasure to this person. Unfortunately, it resulted in them needing this specialist procedure to extract it. Don't try this at home. Here are a few other weird objects. Let me know what you think it is. The first one here you can see on the left hand side on the x-ray. What do you think that is? Looks a bit like a spade. Looks a bit like a piece of plastic or metal. Let me know in the comments what you think. And how about this one here on the right hand side is a CT scan. What do you think that is? A pair of clippers? A pair of tongs? A kitchen utensil? Again, let me know in the comments. Let me know what you think it is. And how about on this x-ray looking from the side, known as a lateral view? What do you think this object is? This one is quite obvious, and it looks like a bottle. And if you think it's a bottle, you're correct. It's a bottle with its contents still intact inside. Who would still drink from this bottle afterwards? Not anybody I know. How about this for this last object? Whoever gets this correct will get 10 out of 10 points. We'll get 100%. Is this a guitar? Is it a violin? Is it a small cello? Is it a musical instrument? What do you think this object is? It is massive, as you can see, extending all the way from the coccyx, coming all the way up into the anterior part of the abdomen. Absolutely huge. And from the image on the right hand side, which is a CT scan, you can see that there's a lot of air, there's a lot of gap, and there's a metal object inside of the key object. Ready for the results? Here's your object. It is some kind of contraption. This looks like it's a purpose-built tool to give someone pleasure. Or it could be a kitchen utensil that I have no idea what it is. So if you know what this object is, please comment down below. Well, that's it for this episode. I hope you enjoyed it. Please like, share and subscribe. Let's grow this channel further. My name is Dr. Miranvir Singh, your emergency medicine physician. Remember, keep safe, stay blessed. See you next time.